My name is John Luth. I'm a private practice dentist in Bemidji in Beltrami County, northern Minnesota, and founder and on the board of Northern Dental Access Clinic. My job is to assess a person's oral health and to help them maintain that as best they can. But what I'm faced with is telling them, here's your condition, here are the things that can be done, but you have only one option. For instance, because the state will not pay for this care that could save your tooth or could improve your oral health or will educate you on how to take care of yourself, you're going to lose that tooth. You're not going to get the care, so your gum disease is going to worsen and you may lose more than one tooth.
I'm Mike Flynn in Lewiston, Minnesota, and I'm the dentist at Lewiston Dental Clinic, which serves 70% of the patients on Minnesota healthcare programs. We are the safety net clinic, I would say, for the 8-county area. Well, the cuts for my patients really mean that their access to dental care is probably going to be very limited. With the decrease in benefit sets, we will not be able to do our preventative care that we've been doing for the 31 years I've been in practice.
Put you under warranty. Yeah.
So.
Good morning, Midwest Dental. This is Heather. On average, we do have to turn away 6 to 10 people a day because of their coverage through the state of Minnesota.
You know, we're looking at people that are going to be losing teeth. So I think it's going to affect the way they look, which I think is going to affect how they're feeling about themselves. To me, it doesn't even make sense to put people through that for a few bucks. It's just not worth it. And I think that to me, doing basic, doing the cleanings, helping people save their teeth is also protecting their health.
All right, Norma, we're going to spin around here.
One of my big concerns, especially with this population of individuals, is that they cannot speak for themselves. Many of them simply cannot communicate at all. They're on numerous medications. They're totally dependent on the state for their well-being and welfare. They will never be a wage earner. They're different than what is normally perceived as the quote-unquote regular MA patient. As I say, they have no voice.
It's taken 25 years to build the infrastructure that Appletree has to serve these vulnerable populations. And with these cuts, that's going to begin to shred this work, and the safety net itself will begin to fall apart.
How you doing, Neil? Good.
In a practical sense, what results is a patient may come into our offices, private or the dental access clinic. The best treatment might be to perform a root canal procedure on a molar, and instead that tooth must be extracted. And we're creating dental cripples. And we're also creating a great amount of concern among the practitioners about standards of care and adhering to their professional responsibility to provide the proper standard of care for treatment.
You know, I usually love to face challenge. Maybe I would tell you that first. And the heavy heart comes to know that the patient will suffer, and we will stick with our patient to the end. You know, we probably will die a slow death, but it's going to be worth it.